And in today's spotlight, Dr. Jamille Broome, labor law consultant, to just speak about what we heard from the president of the Industrial Court on Friday at the reopening of the Industrial Court term. And what she was basically saying, something I never knew, 178 cases filed relating to COVID-19 and 134 in the space of a year as compared to 25 the year before. And she's just saying that while vaccinations may be considered a health and safety measure that can be implemented in the workplace, is that these things cannot be done unilaterally. So I know a lot of people heard, listen, we don't have to take the vaccines. So this morning we have Dr. Broome here to just give us some clarity on what Deborah Thomas Felix has shared with us and how it can be applied in the workplace. Good morning to you, Dr. Broome.
Good morning, Natalie. Thank you for having me again.
You're most welcome. It's always a pleasure. So just let us get some clarity on what Deborah Thomas Felix has shared with us at the reopening of the Industrial Court. What did you hear? Because I saw all the comments all over the place suggesting that people just thought, hey, I don't have to be vaccinated. My employer can't force me to be vaccinated. What exactly is your understanding of what she shared with us?
Well, Natalie, the thing is, everyone is going to see and hear what they want to hear. And I heard the key thing there is that Mrs. Felix required vaccinations to be done only, or she requires consultations. And that is what I heard. Consultations are necessary before anything is implemented. And without consultation, it will be done unilaterally. And if it's done unilaterally, it will be a breach of the employee's terms and conditions of employment. And that is what you were saying. It has to be done with consultation with both the union and the employees. Now,
but we have seen employers, though, who are using, as we spoke about the last time, Section 6 of the OSHA Act to say, okay, you need to get vaccinated because under Section 6, as she mentioned, is that vaccination can be considered, a health and safety measure. So yeah. What do you say to those employers who are using that section of the OSHA Act to defend their decision to have their or to get their employees vaccinated?
Now, in my view, I think that is exactly what an employer should be using to give what we call, quote unquote, a mandated work. However, again, as long as it is a reasonable requirement in that industry or in that business, because I don't think that every employer is going to be able to reasonably justify having vaccine mandates. Some employers with proper social distancing, or you have proper things in place, some of your employees can work from home, then you can't justify reasonably having a vaccine mandate. Now, if you work in a factory setting and everyone is packed closely together, or you have drivers on delivery trucks and those types of really close settings where you can't socially distance, you cannot do everything that you can to prevent getting infected, then you can say this is a reasonable requirement for this position. And so that is how I see it has to be done. It has to be done in certain industries, certain positions, and it must be reasonably justified. If it cannot be reasonably justified, I can see the court going against whatever decisions the employers make.
So in those instances where, as you say, the public health regulations aren't sufficient to give people the protection and to make the workplaces safe, what of the consultations then? Aren't they still necessary?
Yes, consultations are always necessary. But some people think that consultation means that you must get agreement. And that is not necessarily the case. Because if we were to say that everything that an employer wants to do or wanted to do, we require union buy-in or employee buy-in, then you might never get anything done. So consultation has to be genuine, it has to be good faith. You have to present all of the information to the employees, you have to explain to them the pros and the cons of it, and give them an opportunity to then give their side, explain why they are against vaccine. And if it's because of some conspiracy theory, then you give them further information. And you just have to keep going back and forth and going through that dialogue, open that dialogue channel. So it's not about, even after all of that consultation, and the employee is still resistant, or the union is still resistant, then there's something called managerial prerogative. And managerial prerogative means that employers have the right to implement policies that they deem necessary for the continuation of their business operation. So it's not necessarily that we have to get agreement, but you have to ensure that everyone is fully informed and then everyone gets an opportunity to say their opinions on the matter.
But if we go that route, Dr. Broome, and we're also being told by Mrs. Felix that, listen, when you introduce vaccinations into the workplace, it's a change in the terms and conditions of your contract. Wouldn't that still be a breach in the sense that if you don't have that agreement, that you're breaching what you would have originally signed to as your working conditions?
Yes, of course, definitely under normal circumstances. But we are not living in normal circumstances. We are living in the midst of a deadly pandemic where people are dying every single day. So we can't just say that if you do anything, it's going to breach or go or be a unilateral variation of my terms and conditions of my employment. But then ignore the fact that we are living in a pandemic, ignore the fact that I have an obligation under Section 6 of OSHA to prevent and to protect all of my employees at the workplace, then I have a legal obligation as well. And that is what that comes down to, a legal obligation on employers versus a unilateral breach. But again, you cannot just make that variation without consulting with the employees. And that's what it will come down to in the end.
Yeah. But I let me play devil's advocate just a little bit. What of those people who are going to say, okay, if I don't get vaccinated, I have a 2% chance of dying. And if I get vaccinated, I have a 0.5, let me say a 0.5% chance of dying. And they don't believe that that is such a significant difference. How do you justify vaccination as a health and safety measure in that instance?
Actually, what I like to tell people, what I like to ask, have you ever met, how often have you met someone who had an underlying condition and they caught it in the first stages? These things are usually there for years before we ever find out that we have cancer in stage 4 or that we have late stage diabetes. So you can't say that I have a 0.2% or 2% chance of dying because you don't know what you have. So you can't be there playing doctor and saying, well, I healthy, I just run the savannah every day. I run the savannah every day. And I still went and got vaccinated because I don't know what I have. So it's not a matter of saying in your mind that I am a healthy person because that's not how it works. We don't know what is going on with our bodies. All we know is when we get a symptom or we feel some sort of pain or whatever it is, and we go to the doctor and the doctor says, hey, you have stage 3 cancer. That's how it works. So we cannot then say to ourselves that we are healthy people and we don't need the vaccine because that's not how it works. And we want to protect you as an employer from dying and having that on our conscience.
But what do you make of the numbers, though? When Mrs. Thomas Felix told us that normally in a year you'd have about 25 matters coming to the industrial court compared to 134 in the space of a year. What is that telling you about what's happening between employees and employers?
Yeah, I expected that. I actually expected more cases by now. And I'm sure between now and December, that number could probably go all the way up to 300 or more. Because I am seeing it. And these things are not just about vaccines, Natalie. These things stem from last year unilateral salary deductions or salary reductions when people were laid off. It stems from people being laid off. It stems from retrenchment and severance not being paid or retrenchment done the wrong way. So there are many issues that are now coming to the fore. Because I have a couple of them are all included in that number that I was just going to quote. So I know that there are more to come, and the vaccine numbers, I'm sure, are going to ramp up. They're definitely going to, there are going to be a lot of cases because there's not going to be a consensus on this, unless the government steps in.
Right. And we've heard from the government, we've seen people saying that not going the route of mandatory vaccinations because they believe it's going to create even more hesitancy. So then, what do you think is the best way out of this? The last time we spoke about the vaccine passport, and already you don't think people are going to be crying discrimination if we do that?
Well, as discrimination in that context doesn't apply to Trinidad and Tobago. We don't have in our constitution or in our Equal Opportunity Act anything that says that discrimination, you can't discriminate against somebody by medical status. So that is not going to apply to us here. So, but I think that a vaccine passport would be the best way for the government to go, to be honest with you. And that is not because I want to go out online. Yes, I want to go out online. But at the same time, I think that we have to do something to get people to understand that we need to get vaccinated. And I'm really glad to see the numbers of vaccinations has crossed 1 million. So we are on the right track. But we really need people to do the right thing and get us out of this. Otherwise, we're not going anywhere.
Yes.
Especially now with Delta here.
Yeah, but remember, there's also another variant, even though we don't have any scientific data to suggest that it's in the country as yet. Who knows?
Correct,
You
correct.
know,
And Miami Carnival is coming up. I am certain that we are going to have issues when people return from Miami Carnival. I am
yeah.
certain about it.
So then
No?
what can we do to safeguard ourselves? You think even if we have, considering what we hear from the health experts, that even with the vaccinations, while some people may get some kind of protection from the variants, is that a lot of these variants, the vaccines aren't protecting some of them. So
Correct.
even if we have the passport, would it still give us that kind of protection that we're seeking?
Probably not. The health experts will have to tell us that, but with the way these variants are wiping or just moving through states and moving through all these other countries, we're probably going to end up in a lot of problems, but we don't know. We just have to do what we're accustomed to doing now. We have to follow our protocols as much as possible and hope for the best. That's all we can do right now.
Well, what we
So,
do know for certain is that the people who are vaccinated stand a greater chance of not dying and not being hospitalized.
correct, correct. And that is important, but we want that for everyone. We don't
Yeah.
just want that for the ones who are vaccinated. We want everyone to be able to experience that because every time I see a number, another COVID death, my heart melts.
Yeah.
So I don't want to see that anymore. Now, of course, the vaccine is not going to protect everybody. Some people, their immune systems are so weakened that they're not able to produce the antibodies, and there are different factors involved. But at the same time, at least give yourself a fighting chance.
Yeah, I definitely agree. So for the workplace, the employees, employers, one of the things I didn't hear was who was bringing the cases more to the industrial court, if it was the employees or the employers. It would be interesting because
Employees.
the employers that some employees don't want to get vaccinated. And for the employees is that you're mandating this one, it's not mandatory. So it would be
It's
interesting to see.
it is highly unlikely that an employer will take a matter to court because of the costs associated with taking a matter to court. So we can safely assume that out of that 170 plus cases, that the majority of them, if not all of them, would by the unions on behalf of the workers.
Yeah.
That is, I am quite certain that that is the case.
But if you cite Section 6 as a way that employers can say, listen, yes, you have to get vaccinated because if you can prove that this is the way to make the environment safe, then what do you say to the unions then who are clamoring on behalf of their workers, rightfully so, to say, listen, if this is not what you want, we're here to support you.
Now, you see, the thing about the unions is that they have a responsibility to represent their workers. And if their workers are saying we don't want to take this vaccine, then they have to now defend that. I can't see a union saying, well, you know, the employer wants you to get vaccinated, so I really think that you all should get vaccinated. I can't see a union doing that because at the end of the day, you have to represent your people. And if your people are saying we don't want to take it, fine, we want you to represent us on this point, then the union really doesn't have much of a choice. I'm sure a lot of union representatives and union executives, they probably are vaccinated, but at the end of the day, they have to defend what their people want, and
Yeah.
their people mostly are going to not, and they're going to have to defend whatever comes to them.
So you think it's just a matter of needing more education for the employees to understand that this is the way to go?
Not, I think that education has been given from day one. I think there's enough information out there. I think everyone who wanted to be educated on it would have already been educated on it. And I don't think that any more education can change things right now. It's just a matter of waiting and seeing what persons decide to do and hopefully, that they will make that decision. And funny enough, one of my friends was telling me the other day that her sister um, decided not to take the vaccine, and she lost her job at one establishment. And since then, she's been looking for a job, and everyone is requiring you to be vaccinated. So she's going to be there without a job for I don't know, God knows how long, waiting, trying to get another job because she decided to leave. And of course, that is one of the 175 matters heading to the industrial court.
Well, I wouldn't doubt, because if you're saying to us that under the you can't, there's no mandatory vaccination in place, should any worker lose their job as a result of not being vaccinated?
Well, if I am saying to you that you need to be vaccinated because I need to protect my staff, myself, my staff, my customers, my clients, and you refuse to do that, is it really, am I forcing you to be vaccinated? No, I don't see that as being forced.
You are, because
I,
that's not it. Remember, we heard that if you're asking us to be vaccinated, that it's a breach of our terms and conditions. That has to be a matter to definitely go before the industrial court, because
right.
it's the right move to say, okay, if I don't get vaccinated, you can fire me. Is that grounds for dismissal?
As long as I am giving you a lawful and reasonable instruction, I expect you to comply with it. Because we are saying, I'm saying that you need to get vaccinated, but don't we already have issues with where we're telling employees not to do marijuana and come to work? We're telling you not to drink and come to work. And so we are telling you what to do with your bodies already. And we are telling you what to do with your bodies because it is a health and safety issue for the workplace. And if you look at it, if you break it down to this, it's basic pieces. That is basically what it comes down to. It is a matter of us giving you a reasonable, and I keep stressing reasonable because, again, I don't think every employer can justify it being reasonable. It won't go across the board. And that's why I give specific examples. As healthcare, I think the government should mandate vaccines for healthcare workers, right? And police and the police service as well, because those you can't socially distance with four people in a vehicle driving around for 6 hours, So it has to be reasonable, and if it's a reasonable instruction, then how can you tell me that you're not complying?
All right,
And if you're not complying, that's insubordination.
we have to leave it there, but thank you so much for sharing your knowledge with us this morning. And let's see how those 178 matters turn out, and if we're going to be getting more, as you say, by December.
Well, Natalie, we probably will have to wait about 3 years for that, So.
Thanks for the reminder. Thank you.
Exactly. All right. Okay,
All right.
cheers.
Take care, and thank you.